for our 16 Days of Activism campaign. This is our first activity under the campaign, which is our monthly webinar series, our Emerging Practice webinar series. My name is Jessica Gorham, and I'm the Regional Emergency GBV Advisor based here in Nairobi, covering East and Southern Africa. But for this call, I am also the co-chair of the Regional GBV Working Group for East and Southern Africa. So those who are new to our series, every month we have a new emerging practice webinar, which highlights either a newly produced learning brief, such as like today, or best practice that we have seen in the field. If you would like to participate or present in one of our emerging practice webinars, please do reach out to us here at the Regional GBV Working Group for East and Southern Africa. You can contact my colleague, Christine Cabelli, if you think you have an interesting or innovative practice that you'd like to share within the region. So as many of you know, we like to keep this to exactly 1 hour. So I will quickly go over our ways of working. If we could make sure that everyone has your microphones on mute, that would be appreciated. And also, if everybody could please turn their videos off. Please turn your videos off. We have people joining us from all across the region and the world, and some of them have different levels of Wi-Fi connectivity, and it helps them if we all keep our videos off. So please do remember that. If you have any questions for the presenters, please write your questions in the chat. We will have a Q&A or a question and answer period at the end of our discussion. And I will then present those questions that you have written in the chat to our presenters. So please, if you have a question for either Joanne or Dr. Shaza, please do write them in the chat. And I will be putting like questions together and then asking them to our presenters during the Q&A. So without further ado, I would like to present our speakers today. We're really fortunate to have a returning expert joining us, Ms. Joanna Creighton, who is the director of the GBV AORs, or Area of Responsibilities GBV Helpdesk. And she will be presenting a learning brief that they developed that was entitled Finding Ways and Means to Deliver Gender-Based Violence Programming in Hostile Environments. Following Joanne, we will have Dr. Shaza Mohammed, who is the Executive Director of Nada El-Azhar for Disaster Prevention and Sustainable Development, a national NGO working in the Sudan. And she's going to really give us some insights what it actually means as an implementing partner to be working in those hostile environments, delivering frontline services to survivors of gender-based violence. And we're really thankful to have Dr. Mohammed on the line, who she's calling in from Sudan. So thank you so much for joining us. Since I would like to keep it to 1 hour, I think I will very quickly turn it over to our colleague Joanne. And Shiva, if you would like to, yes, great. Welcome, Joanne, to our monthly webinar series. Over to you.
Thank you so much, Jessica, for that warm introduction. And hello, everybody. It's a pleasure to be joining you today. I am Joanna Creighton, the Program Director for the GBV AOR Helpdesk, as Jessica mentioned. And the GBV AOR Helpdesk is a free and confidential technical advisory and research service for all humanitarian actors working on GBV risk mitigation, prevention and response. And I'll be saying a little bit more about how you can reach out to us if you should need any help or support. and I'll provide details at the end of this presentation. So I just wanted to greet you all and put my camera on briefly, but I'll now turn that off so that it doesn't impact your bandwidth. So I'm here today to give some information about a new product that we have published, which is a learning brief on finding ways and means to deliver gender-based violence programming in hostile environments. And this learning brief discusses a range of strategies and methods that humanitarian actors can use to support and sustain their programming in hostile environments. The paper starts by outlining what we mean by a hostile environment for the purposes of the paper, and why it's really important for GBV service providers or GBV responders to be able to identify and adapt to rapid or incremental increases in hostility in humanitarian environments. So let me briefly go over what we mean by a hostile environment in this specific paper. It's an environment where there could be an erosion of women and girls' rights through rollbacks or active repression of those rights. For example, with women and girls facing punishment and violence for engaging in regular activities or practices that are very normal human behaviors, like studying, working, singing, dancing, these types of activities. Could also be an environment where the absence of laws or other protections for women's and girls' rights lead to impunity for acts of GBV, or where there are existing laws and protections, these are failing to be enforced, again, leading to impunity for those acts of violence. A hostile environment may also be one where there is retaliation, led or otherwise condoned by those in power, against women and girls who attempt to assert or defend their human rights. It could be an environment where there is repression and violence against programs and actors who are focused on GBV, but also those programming or actors focused on LGBTQI populations or sexual and reproductive health and rights. There can also be environments where there is general normalization of violence, and there may be the presence of secret police or military juntas who are monitoring women's and girls' movements and behavior. Hostile environments may also be those in which there is a generalized proliferation of small arms amongst the civilian population, again, leading to this general normalization of violence. So overall, we noticed a link between authoritarian, totalitarian, and non-democratic regimes, which can lead to an increased likelihood of a hostile environment for women and girls, and in turn for GBV programming. Hostile environments are usually driven or fueled by anti-feminist or misogynistic ideologies, spread through orchestrated campaigns, as well as ad hoc public rhetoric and actions. In the type of hostile environments described in this research paper, the principal groups leading resistance to or attacks on women and girls' rights, women's human rights defenders or women's movements, and GBVIE programming are likely to be government or government-linked actors or groups. So, for example, armed security forces of government in a country. It could, as I mentioned before, also comprise special units of secret police. In addition, there may be organized armed groups. So this can be another source of hostility to women's and girls' rights. So these are non-state armed groups operating with political, social, or ideological objectives. And they are usually fighting in opposition to the state or for their own vision of life in the territory. So this learning brief discusses some of the risks women and girls face in these high-risk environments and provides information regarding programmatic risk analysis, risk management, and contingency planning. And it concludes with several key considerations for GBV specialists relating to aspects of GBV response, prevention, coordination, and advocacy. And finally, at the end of the learning brief, there are some country case studies to highlight some of the forms of repression women and girls experience globally, and efforts by humanitarian actors and women and girls' rights activists to counter this and to continue to support survivors. I would like to share that the paper does not profess to be exhaustive or fully comprehensive, nor is it a substitute for locally relevant contextual analysis of GBV programming risks and risk mitigation measures. But the findings will hopefully help to inform GBVIE programming and GBVIE specialists trying to work in such hostile environments around the world. So why were we focusing on this specific topic right now? Well, the Helpdesk is a demand-driven service, and we did receive a request to produce such an information briefing to a specialist who is working in a hostile environment so that we may be able to assist them and also others. And as we saw from the literature, as we were studying this, we noticed that there is that the conservative patriarchal forces have always been at work, but more recently they have coalesced to make progress in dismantling existing systems and institutions that have been set up and intended to protect women's rights. And they have been actively constructing others in their place. So this acts as a way to reinstate inequality both at home and internationally, with a key strategy being to co-opt and dilute UN and human rights language in order to derail the collective progress that has been made for women and girls' rights to date. And so we thought this paper would be very timely, particularly to release it just prior to the 16 Days of Activism for the elimination of violence against women and girls, to highlight again the ways in which it's important to stand in solidarity with women and girls and continue to try to provide services to them, even within hostile environments. So now let me outline some of the key risks to women and girls, and also to women and girls' rights activists in hostile environments. You can see these listed out on the screen. I won't go through them all. But beneath the dark pink table, you will also see beneath it in lighter pink that GBVIE specialists and responders operating in hostile environments also face the same risks. And also, if they are non-nationals, they may also face the risk of expulsion from the country, sometimes called being persona non grata. So there are many ways in which humanitarian environments that are hostile to women and girls' rights can exacerbate GBV risks. And oppressive and repressive patriarchal policies and practices targeting women and girls serve to stigmatize, marginalize, and exclude them. Not only does this harm individual women and girls, but it also hinders progress on gender equality. It is important, therefore, that GBV service providers and the organizations for which they work improve the management of risks that threaten to adversely impact any GBVIE program, its functions, objectives, operations, assets, staff, partners, and project participants. Because despite the complexity of operating in these hostile environments, it's really important that we continue to deliver life-saving and sustaining GBV response prevention services and goods. So on this next slide, you will see some information relating to risk assessment and management. On the left-hand side, we have an example of a risk assessment management cycle. So in other words, some of the steps within that type of process. And on the right-hand side, you will see an example of a threat analysis matrix. These are some examples. There are other types of both of these types of model available. And sometimes your organizations will select specific models to use. But broadly speaking, for risk assessment and risk management consists of roughly 5 steps, beginning with the identification and assessment of the risks, then moving to being able to analyze and prioritize those risks. So in other words, then sort of developing and implementing procedures to minimize risks to your project participants and to protect your assets and service delivery, as well as your organizational reputation. Then you may move to being able to treat any risks or deploy other strategies. So having resources and procedures in place to treat and respond to, and indeed recover from a risk, an incident, or learn from a near-miss incident. It's also very important to monitor or track risks in hostile environments. So once risks have been identified and assessed, regularly monitoring to understand if the identified mitigation strategy and approach that you are using is effective, or it requires adjustment, or indeed it requires an adjustment including escalation where the risk and the level impact score has been elevated. And then it's also very important to make sure that we are making any needed adjustments when we identify changes in the threat environment, and reporting on risk, so that ensuring that risks are registered once they have been identified with a clear plan of action of how to respond to an incident. And reporting channels should be clearly communicated to all your relevant stakeholders, making any needed adjustments. So, of course, there is always nuance to be considered, and situations such as hostile environments are not static or uniform, and we know that risks can change over time. Also, our organizations that we work for have varying risk appetites, and this may influence the risk management measures that they elect to adopt. And when working in partnership, GBV actors should discuss any variance in organizational risk appetites so that there is a consensus on the general approach that will be taken, and to the extent feasible, a harmonization of risk management strategies. In the event of divergence of approaches between agencies, these should be determined during a design phase rather than discovering this when incidents occur or when near misses happen, in order to avoid additional risk of confusion in relation to how incidents will be managed. Organizational profiles or perceived affiliations can impact freedom or restriction to deliver humanitarian assistance. For example, in some contexts, local women's rights organizations may be at heightened risk of being targeted than an INGO, or vice versa. So in other words, risk levels can vary by context and actor. Also, what one organization may be equipped and resourced to deal with in a particular context may vary. In hostile environments, it is vital that GBV specialists and service providers are really joining up all the dots on the available data that they have access to relating to risks for survivors. So in other words, looking at and conducting GBV assessments, looking at secondary data reviews, conducting their programmatic risk analysis on a regular basis, as well as looking out for relevant reports and analyses and conflict analyses, and of course, adhering to safety and security briefings. It's by pooling together data from this range of relevant sources and from trusted networks that this can lead to a more comprehensive risk management approach, and at the development of a plan when relevant risk mitigation measures are identified and documented for each type of risk. And of course, these plans should be regularly reviewed and updated, particularly in hostile contexts, where backlash may be operating unseen. It's really important because by following such processes, we can uncover some of the emerging risks and reveal the strategies being used by actors who are deploying them, and being able to counter these collectively. So in other words, our risk analysis should inform our risk management plans. So protecting the rights and freedom of women and girls to live free from the threat of GBV requires concerted and coordinated responses from a range of humanitarian and civil society actors throughout the programming cycle. And the importance of effective contingency planning and emergency preparedness, particularly in hostile contexts, really cannot be underestimated. And contingency planning often is really important because it means thinking through relevant, realistic scenarios and situations and really putting in place a plan for how we may respond in such circumstances. So it means developing strategies, arrangements, and procedures to address the humanitarian needs of those adversely affected by specific crises. And contingency plans that match your context and should be developed and should be based on a relevant and recent situation analysis, which factors for those specific risks to women and girls. And on the screen, you can see a link to some of the key resources that the GBV AOR has available on their website. And I encourage you to look at those and also to engage in relevant emergency response and preparedness trainings when you have the opportunity to do so. Now let me dig a little bit into some of the content of the paper and some of the considerations that are mentioned within the learning brief itself. I will only have time now to give you a brief snapshot on these. So for more information, please do read the paper in full. So here's a flavor under each of the key areas. So in relation to GBV response, one example of a specific feature of a hostile environment is that women and girls will often have heightened psychosocial support needs and may be at increased risk of suicide and self-harm. This is because they may have higher levels of distress due to the compounding factors of violence at home and in their communities. And this means that caseworkers and psychosocial support workers do need to be aware of these increased risks to women and girls' mental health and this increased potential for suicide and other forms of self-harm as coping mechanisms. Both caseworkers and psychosocial support workers should be trained on understanding suicide risk, how to assess it, and how to work in women and girls-centered, non-stigmatizing ways, which listen to what women and girls say their needs are, and to develop supportive suicide prevention case action plans, which do not lead to further isolation or which rely solely on medication. Under GBV prevention, one example of what the paper mentions is that it's really, really important to notice that given hostile environments have prevailing norms that are being promoted which are harmful to women and girls, it's very important to take steps to try to recalibrate some of the harshest and hardline thinking that may be taking root in society and to seek to counter this. So again, this is where it's really, really important that if we have existing knowledge and footprint in local communities where we have positive relations established, that again, we seek to try to identify men and boys who could be allies to GBVIE prevention efforts. And for GBV prevention staff, given that they are living and perhaps working in these harsh environments, it's really important that GBV prevention staff's knowledge, attitudes, and beliefs are regularly monitored, particularly attitudes, to make sure that they are not being unduly influenced by the hostile and negative attitudes around them over time. And supervisors must take prompt action to address any behavior which indicates harmful attitudes, beliefs, and behaviors towards women and girls, to avoid putting survivors and staff in jeopardy. In relation to advocacy, one example that the paper mentions is that in a complex hostile environment, ensuring that safety audits and risk assessments to mitigate GBV risks are happening with regularity is crucial. so that advocacy can then be relevant and reflective of the current needs and situation. Incremental increases in hostility towards women and girls can be subtle, so it is important that GBV actors find ways that they or their allies can move in the affected communities and report on changes that are impacting the safety of affected communities. And one example in relation to coordination, we know that in extremely challenging contexts, the ability to coordinate effectively may fluctuate, and it can become harder for the different levels of coordination to interconnect cohesively. So in other words, the local, regional, and national levels, and routinely for a consistently joined up response. So movement restrictions may make in-person meetings challenging. There may also be surveillance of communication and IT systems that may limit actors' ability to share relevant and timely information. Coupled with this, it may not be possible to widely distribute service mapping or referral pathway information openly, and there may need to be, you may need to be selective in relation to how this information is shared and with whom. But despite this, it is vital for agencies to resist the impulse to retreat into their organizational bubbles or immediate spheres of influence. So streamlining how and when coordination can take place is essential, given the many tasks demanding focus in these contexts. Consensus building amongst GBV actors can build alliances and networks so that trust is deepened, and this can have very positive outcomes also in relation to joint advocacy. GBV programming, feminist activist movements, and other related civil rights movements, even when under severe threat and scrutiny from repressive forces, have still persisted and will continue to do so. Even if these movements for gender equality are driven underground or individuals and their allies are sent into exile, they have demonstrated before and will continue to do so that the struggle doesn't end until the violence against women and girls stops. If anything, the challenge which GBV actors and their allies in such humanitarian responses must center on in those challenging circumstances should be to remain focused on how to combine our efforts and scale up the provision of life-saving programming at such a time when women and girls really need GBVIE programming to meet their needs. So I hope this has given you a brief snapshot of some of the content within the learning paper. And I will now show you that on the next slide, at the bottom of the slide, and I'll put in the chat the link to the paper that I've been mentioning so that you can access this and read this more at your leisure. And I do hope that it will be helpful to you in your work. And I'm really looking forward to hearing from Dr. Shaza soon from her real life experience about what it's like to be programming in challenging circumstances. To wrap up and conclude from my side, you can see that the GBV AOR Helpdesk is available for you if you wish to reach out to us. It's a free and confidential service. So if you need any research or advisory support, please do feel free to use the email address mentioned. And again, I'll put that in the chat as well so that you can pick up the details directly from there. But thank you very much for listening and for this opportunity to share some of the contents of this learning brief with you. And I look forward to hearing from you all and learning from you all about your experiences as well. Thank you. Back to you, Jessica.
Thanks, Joanne, for giving us an overview of the learning brief that was developed by the GBV AOR's Helpdesk. And I think there are definitely some key messages in there. I was really interested when you talked about how referral pathways, sometimes we can't openly publish them. And I think we often get a lot of feedback or concerns from non-GBV specialists as to why we're not publishing those. So I was glad that that came out as one of a risk factor for both service providers and survivors as one of the reasons why we don't always, in every context, publish those. Shiva, if you want to put up Dr. Shaza's slide, that would be appreciated. We're really pleased, as Joanne said, that we have Dr. Shaza Mohammed, who will be joining us from a local organization in Sudan to really put all of those concepts that Joanne spoke about into a context, because she and her colleagues are very much working in Sudan in very complex environments. And so, Dr. Shaza, I'm going to turn it over to you. You have about 10 minutes, Dr. Shaza, and then we'll go over to the Q&A. Dr. Shaza?
Okay, thank you very much, Jessica, and thank you very much for all the organizers. Again, my name is Shaza Najmuddin Ahmed Muhammad. I'm the Executive Director for NADA Al-Azhar organization. NADA is a woman-led national organization based in Sudan. Currently, I'm speaking from Cairo on my way to Halfa, to the northern part of Sudan, to support the team there. NADA is also representing the national organization within the strategic advisory group for the GBV in Sudan. I'd like to talk more about the practical GBV operation under the current situation in Sudan. And as you all know, as of April 15th, the conflict started in Sudan. And as we all know, also GBV is always used as a weapon of war. And under the circumstances in Sudan, it have been used heavily as a weapon of war to create fear and terrorize the population. Being accompanied by lack of access to health services, education, and employment, particularly for women and children. And here I'm saying children because it's also very important to highlight the GBV violation and risk that have been witnessed by boys during this difficult time in Sudan. It's really worsened the situation. Moreover, the absence of laws and other protection of women and girls' rights, it paved the way in front of horrible acts of GBV. I will highlight some of the most common GBV violation currently in Sudan, which among others are the sexual violence, early and forced marriage, intimate partner violence, but most dangerously is the organized GBV crime, which including illegal immigration and forced sex work. We have shocking numbers of incidents of sexual violence, including rape, sexual exploitation, and sexual assault. And unfortunately, access to survivor center, legal protection, and access to justice through formal mechanism is very challenging. Currently, the sexual gender-based violence survivor among women and children are women and girls are forced into marriage with the perpetrators of sexual violence, which make the situation more complicated and tough for women and girls. And this is due to the lack of accurate information about the risk and benefit of legal and justice and protection referrals. On the other hand, also there are limited number of specialized services which increase the likelihood of sexual transmitted diseases or unwanted pregnancy. And I would like also to highlight that in Sudan, with the current absence of a legal system, it's worsened the survivor situation. For example, the BIP kits are not provided unless the survivor has a form from the police, which called Form 8, which normally issued at the police station or at the hospital. And in some hot areas, like in Khartoum, for example, police is not existing or police stations are not functioning. So it will be very difficult for a GBV survivor to obtain that form, and hence it prevents her from access to health and other GBV services. Also, the abortion for the unwanted pregnancy is impossible because it's required a court degree, which also it's not it's not possible in many locations, especially in hot zone areas. On the other side, new phenomena, including trafficking, as we all know that, trafficking is increasing during the conflict due to the breakdown of political, economical, or social structure. But trafficking in person now is increasing, and it put more women and girls at the risk of GBV accidents. And this is due to the lack of opportunity to cross the border. For instance, like in Wadi Halfa, where many women and girls are waiting to cross the border to Egypt. And this forced people to take dangerous road. And most importantly, it's really normalized the GBV as an addition element of the previous existing discrimination, which were there before even the conflict. So now I would like to navigate together with you and to take you deeper to what currently we are facing as humanitarian actor, and more specifically as a woman woman-led local organization providing GBV services in hot zones. It's really put all of us at a heightened risk of harassment, humiliation. And when I'm saying humiliation, I would like also to explain exactly what I mean by that. It's really, if you are working as a humanitarian actor and it will take you like more than 15 days, going from 8 a.m. to 5 p.m. awaiting for approval for some activities, which could also result in rejection of core activities, especially for GBV in hostile environment. We really need to know where and how to deliver GBV response. It's very delicate. It has a lot to do with culture aspects, with social aspect. And again, we find that, from relevant partner and authorities, sometimes we are plucked to ensure that we are delivering in the best way to do. Also, it's very important, as we all know, that we need safe spaces whereby GBV services could be delivered, in particularly provision of psychosocial support services, including individual or group counseling, sharing of accurate information on the available services and services provided, and refer and safe referral. It's really need a safe place where all those activities could be delivered and implemented. And unfortunately, until now, in some areas, we cannot get approval for constructing or rehabilitating or finding a safe space where women and girls can receive the GBV services. This is not because the authorities just reject that, but to be honest, it's more about the knowledge on GBV and what GBV is about among the partners there, especially in areas and states which didn't witness any humanitarian response before, like the states in the northern part of Sudan. So first of all, we need really to make sure that all stakeholders are aware about the GBV operations, how it's functioning, what are the minimum standards for GBV, and what is the benefit of GBV to the communities, including the host communities themselves. And honestly, it's very delicate and complicated, because sometimes you need to respond for the IDPs or refugees. At the same time, you need to respond to the hosting communities GBV concerns and risks, which could be differ from one population to another and from one community to another. So humanitarian actors who are delivering gender-based violence services should be very diplomat in really sending messages and sending awareness raising or advocacy effort. At the same time, we need to leaving no one behind, to look in a broader picture to the newly IDPs as well as the hosting communities, to ensure that we are not harming the communities by introducing or by bringing the GBV intervention in the area. Finally, under the current circumstances in Sudan, as I said, GBV operation, it's really very delicate humanitarian operation. And if it is not implemented carefully and correctly, there will be a high likelihood of disruption and suspension of, such as suspension of projects or closure of organization. So we have to be very diplomat, and we have to consider the culture and the conflict-sensitive issues in implementing our operation. At the same time, we need to think about the effective preparedness and contingency planning in order to minimize the harm and damage. Also, we need to ensure that women and girls are really saved and they have equal access for the services that are provided in the humanitarian context. I think that's all from my side, and thank you very much for your time, and I will be more than happy to receive any comments or ideas or any experience from colleagues on the call from their experience in other countries. Thank you, and over to you, Jessica.
Thank you so much, Shaza. Those were really, really interesting insights. We have a few questions that I'll get right into because I know that we're running on time. Maybe I'll start with Joanne, and then I'll switch over to Shaza. Joanne, and then actually, I think that this might be for both of our speakers. We do have lots of women or representatives from women-led organizations on the line, or people who are working for civil society organizations. Do you see a difference in the risk factors between our civil society counterparts versus those working in the international humanitarian community? And if so, maybe just provide a little bit of insights as to what those are. I'll do Joanne and then Shaza. So the question again, Joanne and Shaza, was we have a lot of women-led organizations or representatives from those and civil society organizations who are listening in today. Do you see a difference in the risk factors in terms of those working for civil society organizations versus those who are attached to international humanitarian entities? Over to Joanne, and then I'll ask Shaza the same. Go ahead, Joanne.
Thank you very much for the question. It is a very thoughtful one. And I think it's not easy to give a sort of blanket answer to this. I think it's really important that we're aware of the specific context in which we are working, and who is at risk and who is at risk from who, and in what ways. We do know that if you are working for a CSO or a local organization delivering GBV services, that that you may be facing risks, and you may also be facing risks if you're working for an international organization as well. I think what's really, really important is to understand what to do the analysis of your service users, the risks that they face, but also the risks that you may face as program staff, and who is at risk from what and from whom, and to really keep, as I say, assessing and scanning your risk environment, analyzing those threats, and making sure that there are risk mitigation measures in place, and that reports of near misses or incidents are being made from local staff, national staff, and international staff, that you're all doing that whenever you're experiencing risk. We do know that that resourcing does, of course, is also an important factor. We know that local organizations may, due to the way that funding mechanisms work for GBV programming, may be receiving fewer resources to deliver GBV programming, and therefore perhaps also not have as many resources to put into risk mitigation and risk management processes. I don't wish to generalize here, but that may be a factor compared to those that are working in international organizations that may have these established systems, structures, and resources built in. Not always, but mostly. So that I think might be one of the differences to indicate that might be impacting on staff working for different types of organization. But it really does come down to context, knowing what is the specific risk, who is posing the risk to whom within the environment, and making sure that there is resource and mitigation against those threats being realized.
Great, thanks, Joanne. Shaza, did you want to add anything to that question or the response?
Yeah, actually I have a quick point. Thank you, Joanne. She covered more or less all about the context. It's really differ on who will be on risk, and the risk is happening from home. But as I love to use, I mean, for international organization, one of the risk could be like to be I mean, to send them out of the country, or to identify them as persona non grata. Which we also at local level, we do have that, we call it psychological PNG, which is when you are sent from a place or the organization is closed or the operation is under suspension, or maybe also a rejection from implementation of some GBV activities. And I can assure you that I mean, national international organization, they both face sometimes some type of risk, but it depends on what is the what are the measures that the organization is taking. And in Sudan currently, it really very unique, because in different states you need to take different approaches and different methodologies when you are implementing gender-based violence operation, to ensure that you will minimize the risk that could be happen or accompany the GBV operation at any time. Thank you. Over to you, Jessica.
Thanks, Shaza. We have another question for you as well, Shaza, both in the chat and then one that was sent anonymously. One, and I think they're actually related. And the one in the chat is, how can we know that traditionally in Sudan there has been conflict in the Darfurs and other areas, protracted crises. And so how in the current context in Sudan do we not only look at the traditional conflict areas, but new areas and new forms of GBV and trauma, and maybe just giving a little insight into that. And part of that, I think, new forms, you mentioned, Shaza, which was interesting, that you're seeing a lot more incidences of GBV perpetrated towards boys, for instance. And so maybe you can give a little bit of insight on how that's being responded to in the Sudan by organizations such as yourself, when you're having new contexts and then also new forms, and maybe a new, or at least we're knowing more now about more survivors, and both boys, probably men, women, and girls. Over to you, Shaza.
Thank you very much. I think the question is a very a very important one. And yeah, in Sudan, since a long time, we used to have different type of intercommunal and other types of conflict. And during the previous 20 years, GBV have been really changes over the time in terms of risk, in terms of response and prevention methods. Taking from Darfur up to now Khartoum and other areas in Sudan, like Kordofan and Blue Nile, the situation is more or less the same. It's a very tough war where people are being used as a weapons. Bodies of women and girls in particular, and boys have been used as a weapon. And I think, Jessica, this is also due to the, as I said, the culture dynamic. We need to be culture and conflict sensitive in all our programming whenever we want to program a gender-based violence operation, because if we don't consider the culture and the conflict, GBV as a standalone operation will never sustain. I will give a live example on as you stated clearly, that now we start to have a new phenomena of having also boys being a victims or survivor of going they they witness many type of harassments, including the rape, which was not the case, or it was not reported by these big numbers during the current war, and it's due to the settlement of the IDPs in some location. For instance, in majority of IDPs now, they are settling in schools and universities. We don't have like a regular a well-organized camp where family could stay by like a household family level. But now we have like people staying in schools where women and girls and boys and men are all staying in the classes. And according to the culture in Sudan, if the boy is like 10 years and above, like 11 years, 12 years, he should be moved to the class where there are the men, so he will stay with those foreigners, those strangers for him, and he need to spend the nights with those people, and we don't know the people, and then he will be at more risk of GBV, or at higher GBV risk. To do that, we work at the locality level or at the state level, and we do advocacy together with the child protection subsector and the protection subsector, and with the lead of the GBV subsector in Sudan. We're trying to advocate for really considering children and not isolated them or separated them from their mothers and their family during the nights. This could be like one of the way forward, among others. But we are trying also to find out many other reasons to minimize the risk, because the risks are known, and it's due really to the child labor. Children now are working, exposure of children to work in a tough places and in a far places from family, and also the settlement of the IDPs. And it's a complete different scenario from what we had in Darfur before, because normally in Darfur we used to have like a well-structured IDPs settlement or camp. I hope I answered the question.
Very well, Shaza, thank you. I'm just gonna, we have a few more questions, but I'm noticing we're running on time. So I'll ask my last question, and this again could be for both Joanne and Shaza. They were wondering about safe ways through which organizations working in hostile environments can share the reporting and referral mechanisms to the survivors. Because we noted that often those very documents or information can put service providers at risk. So what are some examples that others might have of how that has been shared? Joanne, I'll start with you, and if you have any, and then over to Shaza, because I think you're probably operating in that environment right now. Okay, over to you, Joanne.
No, I'll try to keep this brief, but again, it comes back down to what's going to be safest in your environment and not do harm. So it may, if you're able to have static safe spaces, and to do community messaging and make sure that there is information out there, then by all means, then continue to do so, but continue to analyze for risks or changes in your risk environment. It may be that you are adapting your programming to do temporary safe spaces, and again, communicating about those services, for example, through word of mouth, through trusted networks, through trusted women's leaders. You will have kind of identified who you should do your kind of mapping, your stakeholder mapping, and understand who are your allies and supports within communities. That's really, really important. You may also decide to adapt and have perhaps more integrated programming with other types of services that have perhaps got more acceptability from authorities than perhaps the profile of GBV programming has, which can allow you to still reach at-risk women and girls or GBV survivors and provide them with the services that are needed. So I think that's just a very quick answer, but definitely, again, be guided by your context.
Really good advice, Joanne. And anything to add, Shaza, to our last question?
Yeah, just quickly. Now, currently in Sudan, we're trying to do different level of ensuring that we will ensure the safety of the humanitarian actors, including the GBV actors. So we work through community-based programming. So we train we establish and form a complaint and response committee from the targeted communities themselves, and we train them on all the aspects of humanitarian principles and GBV in emergency and the protection principles as well. Confidentiality and integrity and importance of really reporting by a very safe way of reporting and so on. So we train the community on that, and we try to make to create a trustful or trusted networking. This at community level. At service provider levels, we are conducting GBV trainings for non-GBV actors. So when we establish, we conduct the stakeholder analysis, for instance, in Wadi Halfa in northern part of Sudan. Then we have the service mapping, and then we have the referral pathways in place, so we know who can do what for the survivor and on what basis. And then we train those stakeholders, all those stakeholders on GBV in emergency and on GBV reporting, including again confidentiality and the sensitivity of the topic, and the do no harm approach as well. So we try to do it at two different levels, and to ensure that we will create a trustful network to enable us to work together on GBV operation. Also in Sudan, we have the support of the subsector, the GBV subsector. They created there is a coordinator in all, in more or less in the majority of the states. And then we have the referral pathways service provider. I mean, the service provider within the referral pathway for GBV operation is kept confidentially and in a very well and safe way, and our system to ensure that we cannot put our colleagues or ourselves at the risk. Thank you. To you.
Thank you, Shaza. That was a really good summary, I think, or a practical way or application of what Joanne had just mentioned. I see that we're on the end of our hour. As you know, here at the Regional GBV Working Group for East and Southern Africa, we like to make sure that we keep time. I want to thank Joanna Creighton from the GBV AOR's GBV Helpdesk for being with us today, and also Shaza Mohammed, who is the Executive Director of NADA, a local women's organization working in Sudan on the front lines. And some of the things you mentioned, Shaza, as those risk factors, it's even hard to imagine that even service providers putting themselves at risks, during these times. So during this 16 days of activism, I hope we all think of our counterparts who are working in very complex environments, in very insecure environments, and think about what we can do to promote safe access, but then also just sending our sort of positive energy out to everybody who's doing this on behalf of survivors throughout the region. So thank you again, Shaza, for joining us, and please send our good wishes to all of your colleagues. Please note, we had some questions in the chat about this webinar. If you would like to share this webinar as one of the activities for your 16 Days of Activism campaign, please feel free to do so. You can access it on our YouTube channel. If you go to YouTube and then just search for GBV AOR, you will find our this webinar, as well as hundreds of other resources and learning events that you can share throughout the 16 Days of Activism on behalf of the GBV AOR. And please do join us for the next 2 weeks, because the Regional GBV Working Group for East and Southern Africa will have additional events. So look for our emails as the days go on. We're really pleased that you all joined us today. And thank you for being a part of our 16 Days of Activism campaign. And thank you again, Shaza and Joanne.
Thank you, Jessica. Thank you all.
Thank you, and have a good